The surgery is conducted by either breaking the femur or the tibia
And fibula.
and fibula. And that's the tibia and fibula are like one and the same for that segment.
Yeah, because if you think about it, right? So here's fibula, here's tibia, right?
Mhm.
If you just break the tibia and you lengthen it, this one's still connected. So you have to break them both in order for you to be able to lengthen the...
And then actually lengthening it, how does that occur?
There's two ways, internally and externally, right? There's multiple externals. The most commonly, I wouldn't say it's the most commonly used, because a lot of people do kind of the old school method. The best way to do it with an external fixator is called LON, lengthening over nail, where you have an external fixator. Have you seen the video of me lengthening my legs at the mall?
Yeah, I think so.
Yeah.
Crazy.
I know. Yeah.
That's some viral content right there.
I know. It got a lot. And it's been shared a ton. It's crazy that I did that. Anyway, so there's an external fixator. It's both in and outside of your leg at the same time. And you're like that for months, right? It's no infection risk whatsoever. And then you have a nail that's inside. So what they do is they break your tibia and your fibula, right? Mm-hmm. And then they open up your kneecap and then they drill the bone marrow out of your tibia. They put in a titanium nail, and then they put pins that are like almost like as thick as like my pinky, almost, and they connect the external fixator to the bone with those pins, and it's lengthening over the nail, meaning like the nail is serving as a guide, and the fixator is doing the brunt of the weight bearing. Right, but the nail is kind of serving as a guide to keep it somewhat straight. And then once you finish, you use an Allen wrench. You put an Allen wrench in the fixator, and 4 times a day, you lengthen it by 1/4 of a millimeter. So it turns out to be about 1 millimeter a day is the recommended lengthening. And you do that every day until you've reached your desired length. And then you have what's called the fixator removal surgery.
Presumably there's a limit where you should stop though, based on their recommendation. Because you said until you get where you want, like what if you just keep going?
You can. I know a guy who...
Still going?
No, no.